Good morning, afternoon, and or evening, and welcome to the End Minnesota Boys 2 webinar, co-hosted by the Carlson Family Foundation and PACT by ECPAD USA. My name is Dr. Christian Tuala, and I will serve as today's moderator. Today, we will listen and learn about a critical but often overlooked issue, the sexual exploitation of boys. In just 2 minutes, we'll set the stage for an eye-opening discussion that delves into the complexities, challenges, urgent needs, and action in this area. Sexual exploitation knows no bounds, affecting individuals regardless of gender, age, or background. However, the plight of boys facing exploitation remains shrouded in silence and stigma, hindering both acknowledgement and assistance. Throughout history, societal norms and misconceptions have perpetuated the notion that boys are immune to sexual exploitation or that their experiences are less significant. This damaging fallacy not only obscures the reality, but also undermines efforts to address the issue effectively. Today, we'll confront these misconceptions head on, shedding light on the harsh realities faced by boys who are victims of sexual exploitations. Moreover, we'll examine the systematic factors that contribute to the vulnerability of boys and the realities of services offered and their shortcomings at times. By understanding these dynamics, we can better advocate for policy changes, allocate resources, and provide comprehensive care for survivors. But this webinar isn't just about raising awareness and sharing findings of research. It's about catalyzing action. In just 2 minutes, we scratch the surface of a profound and urgent issue. So let's dive deeper, engage in meaningful dialogue, and commit to making a difference for boys affected by sexual exploitation. Welcome once again, and thank you for joining us on this important journey. To start off our discussion today, I would like to welcome to the panel Program Director for the Carlson Family Foundation, Ms. Dana Jensen.
Thank you so much. On behalf of the Carlson Family Foundation, I would like to thank you for attending this webinar. The foundation is committed to working together with the community to create hope and a sense of opportunity, hope, and a sense of belonging for every young person. A few years ago, as we were working on our theory of change for preventing sex trafficking and sexual exploitation of youth, we noticed that there was a lack of services and knowledge about boys and male-identifying youth and their risk factors and experiences. So when PACT proposed this research project, we very enthusiastically offered our support. And now that we have this research, we want to share it with as many people as possible. Next steps for us will include brainstorming with our partners how to implement these recommendations. So thank you again, and please feel free to reach out to me or anyone at the foundation with questions, concerns, or ideas.
Thank you, Ms. Jensen, and thank you to the Carlson Family Foundation. Next, I would like to introduce Jared Davis. Jared Davis is a researcher and advocate with over 15 years of experience in the international development sector, focusing on the rights of children and vulnerable population. His work centers on designing and evaluating evidence-based research and programming for children who have experienced sexual exploitation and violence, particularly in Southeast Asia. With you all, Jared Davis.
Great to have everybody here. Thanks. I'll save a lot of my words for my presentation again. Or am I presenting now? Shall I go ahead with, I'm presenting now. Okay, sorry about that. I was, well, yes, as you said, my name is Jared Davis, and I'm a social researcher and consultant. I'm bringing up my slides. Here we are. So I'm really happy to be able to share this presentation with you. I'm going to try to get my some high-level insights finished in about 15 minutes so that we can spend a lot of time talking and discussing and hearing from our panelists. But as I said, our study is in Minnesota Boys 2, and it was guided by three crucial questions that aim to uncover the hidden realities and challenges faced by this vulnerable population. First, we asked what cases of CSEA involving boys are showing up in caseloads for service providers. And secondly, how are our boys referred to the organization for support and services? And what barriers or challenges exist that might limit or prevent boys and young men from receiving adequate services? So to gain a comprehensive understanding of the realities faced by sexually exploited boys and male-identifying youth in Minnesota, we employed a multi-touch strategy that engaged over 100 support workers across the state. This approach included 25 semi-structured interviews, disseminating an online survey to 40 participants, and facilitating focused learning workshops with more than 40 attendants over 3 different learning workshops. And that allowed us to sort of unpack some of the things that we were learning in the survey and semi-structured interviews. So it allowed for a kind of iterative develop and grow as we learn type process. So our study captured insights from direct support workers who work tirelessly on the front lines, program administrators who oversee the critical services, researchers who dedicate their careers to understanding these complex issues, and advocates who fight for the rights and the well-being of these vulnerable youth. Now, because it's a complex issue, there's a lot of intersections of different factors and vulnerabilities. So to make this complex web of factors a little bit more understandable, we turn to the socio-ecological model, which is commonly used in social work as our conceptual framework. And that allows us to examine the interplay of influences at multiple levels, that the individual, interpersonal, institutional, societal, and policy levels that contribute to the risks and challenges faced by these young people. And so that's going to also guide this presentation as well. Starting at the individual level, the online survey paints a picture of the various forms of exploitation encountered by boys and young men in the support workers' caseloads. And this is looking at the types of boys and young men that appear in their caseloads. We see 70% reported working with boys and male-identifying youth who had engaged in sex trading or been solicited for sex. Grooming was another common experience. Grooming was another common experience, reported by 65%, having boys in their caseloads, followed by trafficking for sex at 52%, sharing explicit images of themselves, 47%, and having explicit images shared without their consent, about 40%. And exploitation through camming, webcam, types of exploitation in a third of the cases. So when we look at the demographic data through our semi-structured interviews with support workers, we start to see a troubling pattern of overrepresentation among certain groups, especially Native American, Black, and Latino youth were disproportionately seen and impacted in caseloads, as well as those experiencing homelessness, identifying as LGBTQ plus two-spirit, and having a history of abuse or neglect. So many of these youth were also involved in the justice system and had experiences of violence or neglect at home. We see that the age range is about 11 to 24, so it's a broad age range, but really the majority of people that are actually receiving services are much narrower, about 16 to 18 years old. Younger than that, they tend to be seen in the government, that tend to be taken care of within government services. And older than that, they often age out, depending on some program. A lot of programs, the Link is one of them that has a very open kind of age range that allows them to work more in those gray areas. And we also noticed that there is a very low service utilization by cis males. So that also may, and we'll talk about that more, some of the complicating factors that might make this data difficult to actually see, because there's very low reporting among those groups. The data on the age range of clients served. So the majority of clients, like I said, fall between the ages of 16 and 18 years old. However, but when we look at the most And so that's seen here by the yellow line. But when we look at the most common age of first exploitation, so the first time they experience what they're seeking services for, most of those experiences took place between the ages of 11 and 14, according to the reports of social workers, which show a considerable gap between the age of first experiencing abuse and exploitation and actually receiving services, if services are received at all. And we'll again talk more about those complicating factors as we go ahead. So now moving on to the relationship, looking at some of their interpersonal relationships. So the research reveals a range of family-related risk factors, including caregiver mental illness, substance use and abuse or misuse, lack of support and dysfunctional or often exploitive dynamics within families and communities, a lot of intersecting strains, socioeconomic strains, a lot of families that are trying to make ends meet, as well as generational trauma that often figures into a lot of these situations, a lot of caregiver strain, a lot of lack of support, and again rejection of often youth who may not identify, men who aren't tough enough, men who are might be broadly queer identifying youth that are often showing up in a lot of these caseloads. But these findings underscore the vital importance of family strengthening and developing support systems as a key component of prevention and intervention efforts. Moving beyond family, looking at peers and community, we also see challenges, resilience and vulnerability. So we see that kind of powerful influence of peer relationships and community factors on the risk of sexual exploitation for boys and male identifying youth. So one particularly concerning trend was the impact of gang involvement that came up quite a bit. So while gangs often offer a sense of belonging and security, which can actually alleviate some of the issues that they might be facing in families, communities, but they also often bring with them violence, substance abuse, and other high-risk activities that complicate these things. They often can also harm victim identification when you say, "Oh, those are kids running with the bad kids." So they may miss some of the vulnerabilities that are underlying that. Social isolation, negative peer influence, also we're seeing commonly in our discussions. Traffickers were discussed, and a lot of our discussions were described as being especially adept at exploiting these social networks, using peer pressure, false promises, the lure of friendship, the lure of material, having an iPhone, was all. Traffickers were very, very aware of those dynamics and often exploited them with boys and male identifying youth. It's also perhaps the most disturbing finding was that trusted community members like teachers, mentors can also be perpetrators of exploitation, which we well know. These individuals often use their positions of authority and influence to groom and abuse youth over time, and betraying the very trust that they're meant to uphold, and oftentimes using gender dynamics that, well, it's okay because you're a boy, or you it's just for fun anyway. You wouldn't want people to think you were gay, would you, if you disclosed, or whatever it may be. They often will use those against them. As we examine kind of as moving on to institutions and organizations here. So, I mean, perhaps the most glaring, I think, finding at this level of analysis was the lack of safe and appropriate housing and shelter for this population. So in the entire state of Minnesota, there are, and this came up several times, that there are only 6 emergency shelter beds dedicated to serving boys and young men. All of them happen to be under the link under Beth's organization, who you'll hear from later. So they have a big responsibility on their shoulders. So So 6 beds in a state of 5 million people to serve a population of young people who are among the most, some of the most vulnerable and marginalized in our society, understanding these intersectional factors. So the scarcity of housing options often forces the exploited boys and male identifying youth into a series of often impossible choices. They can either return to their abusers, take their chances on the streets, or risk being placed in prisons or homeless shelters that are ill-equipped often to meet their complex needs and may even expose them to further trauma and violence. So support workers note this, and they talk about how the justice system often, rather than providing a safety net for these youth, all too often criminalizes and punishes them for the very trauma that they've endured, often citing signs and symptoms of trauma, being aggressive, quick to anger, being jumpy, and they often will point to those signs and symptoms of trauma as well, as signs of people being aggressive, not seeing these identifiers. So biases and system failures often within the welfare system, child welfare system, also contribute to this under-identification and the inadequate responses to male victims. So, and this is something that just is felt really across the board that we'd like to talk about more. Some things that we find, service provider challenges that they say come up regularly in doing this, is that building trust, especially with boys and young men, requires time and often meeting a lot of prior needs that are already existing there. There's a need for relatable providers and mentors. That doesn't necessarily, I mean, and they specifically, there is a big need for male identifying support workers, with the caveat that it's not just that males should be with males or males, but that people should have a choice and have different, because we need to be seeing gender as identity, as the spectrum of identity, right? And so we need service providers that are able to meet young people where they are. So that was brought up quite a bit. As I said before, trauma indicators vis-a-vis boys being boys, gender stereotypes and assumptions that often minimize recognition. Challenges coordinating care with fragmented systems across agencies. And a much greater awareness need of grooming tactics and how that functions within communities and the ways in which boys and young men are vulnerable. And we talked about some of that in the report. One quote says, "The standard screening tools are designed for girls and female presenting youth. They rarely flag boys as being at risk." So that's talking about the screening tools, let alone the cultural and social assumptions and biases that might be existing unbeknownst to the support worker, often in the back of their mind. So these are layers of things. And we move on to the next level and talk about the social and cultural level. So cultural norms and societal attitudes about masculinity often play a significant role in shaping the experiences and vulnerabilities of exploited boys and young men. So stereotypes that portray males as inherently strong and vulnerable, aggressive, can often deter the identification of male victims and discourage help-seeking behaviors. So being able to say, yes, I do need help. Yes, those services I need that. Homophobia and taboos often surrounding male victimization often further silence and shame behaviors. So particularly among cis males, you can imagine where there might be, you see a lot of that pressure to, but also among gay males or among people on the whole spectrum of gender as well. So biases and victim blaming towards adolescent boys often deter help seeking. Rigid gender norms, as we talked about, all are huge parts that come into making this challenging. So a couple of quotes that we found here from direct support workers were that we are still attached to archaic gender stereotypes when it comes to sexual presentation. As progressive as everyone is, as much as we are aware of inclusion, and I'm very impressed with all of the interviews that I've had. They're dedicated, hardworking, passionate, nuanced conversations with support workers. They know their stuff, but it still isn't closing those gaps. And there's a real need to really think through what is it like to be a boy who is vulnerable and attempt to reach out. And that might be some questions for phase 2 of this research if that goes forward. Another response says no child should be so vulnerable that their basic needs are leveraged against them. Getting towards the end of the policy level here. So Minnesota's safe harbor law, which was enacted in 2011, represented a significant step forward in addressing the exploitation of youth. It aimed to treat sexually exploited youth as victims rather than criminals and provide them with specialized services and support. However, as we've seen throughout our interviews, challenges remain with ensuring that the harbor is actually safe for boys and young men. Gaps were found in trauma-informed identification, inconsistent training on screening tools, and risks of re-traumatization often damage trust and commonly hindered safe implementation of that. So so that was and mandated reporting was another issue that came up as well. Like, as we said, that trust, the distrust of the system is extremely strong among male identifying youth, mainly because of how they have been socialized, the experiences they've had, what they've been told is okay and not okay for boys and young men. So mandated reporting often you have a lot of support workers, a number of support workers that brought up, not saying that mandated reporting is a problem, because it helps us identify people who need help, but there might need to be some further discussion of how that works in context. We have a lot of people talking about how many victims are kind of paralyzed and by gender norms and expectations, and they might spend a long time working to try to make them feel comfortable and safe. But then when they come to actually disclose, action has to be taken, and they might clam right up because they're not ready for this to become public or this to turn into action. So there's a need for some nuance there. One person says every wrong door is the wrong door. They're either locked or they're really scary. Another says we can't just keep intervening after lives have already been devastated. We must go upstream and tackle the root causes. So try to get through this quickly, do a high-level overview. So we've attempted to kind of put together a kind of ecology, looking at all of these different levels of experience of boys and young men. And we found that there's a complex interplay of factors at each level that creates this unique set of challenges and barriers. And they interact with one another, these different levels, and they're informed by one another. So it is a systemic thing that needs to be unpacked. High-level recommendations here: a shift in mindsets and approaches. There's a need to step backward and think, okay, what is gender and how are we addressing it, right? And coordinating tracking and data sharing across systems, reducing criminalization through policy changes. There is a direct connection with a lot of the racial and social justice movement in this. When we're talking about male bodies, we're often talking about Black and brown male bodies, not only, but oftentimes. So there's an importance to bring in those discussions so that they can be a part of this too. There's a lot that we can learn from them. Recommendations for social service providers. High level housing and placement is extremely important. Engaging male youth meaningfully, meeting them on their level where they're at. Not just being inclusive in name, but actually in action, and being responsive to however people respond based on their needs, based upon their gendered needs, however that is. The need for investment in mental health care, for child welfare systems, screening and identification. If you get a chance to, we get a little discussion about the PIP FASO and some of the well-intended diversion programming for young males that is in the report that is something that I don't have time to get into right now, but I think is an important conversation about victim identification and where it takes place in these sort of anti-recidivism programs. For law enforcement, need for foundational training. Everybody is able to point to the police officer, so and so, who's a great example and knows his stuff and really provides great resources. But those aren't often the resources that are the ones who meet people in the field. They're not the beat cop. They're not there's a need for this to be really a values level change that's so deeply, so they understand the roots of these things. Diversion and community response is important. Referrals and collaboration. I've got a few seconds left here. With future directions, and this is my last slide here, just to note that our study did not directly engage with survivors, and that was intentional in this design because we wanted to talk and do a mapping first before, so that we can kind of develop those connections and entry points to have safe, trusting conversations with people who have lived experiences in the context. But in order to do that, we sort of needed to paint this broader picture and understand how to have these conversations. So I think we have a better idea of that, but something to keep in mind. Participatory qualitative research is needed that amplifies the voices of male survivors, and similar, censuring survivor voices in future research. All of that is very important. Really quickly, in closing, I was fortunate that I was a part of the Global Boys Initiative, and I did the analysis for 5 or 6 different countries in the Global Boys Initiative with PACT International. It's something that's still ongoing. As I was doing this research, I was really amazed. I was kind of shocked at how similar what we see in Minnesota is to what we see in Cambodia and Sri Lanka and Hungary and South Korea and Philippines and Morocco and Bolivia. And these are global patterns, and it is the impetus for something bigger, I think, a bigger response. But that's all I have got. I would like to thank Carlson Family Foundation for their support, not just financial support, but their actual emotional and moral support as we're going through this. ACT research has been amazing. PACT, obviously. Montana, Veloteo, who's not here, they are outstanding. Yeah, lovely people that I've gotten to work with. That's all for me.
Thank you so much, Jared. And thank you so much for the work that you continue to do, as I know this is not the end of the journey, but a continuation of a very, very long path. Next up, we have Dr. Camille Brown. Dr. Brown is an assistant professor in the School of Nursing at the University of Minnesota, where she conducts research focused on the resilience of marginalized youth, particularly in relation to the LGBTQ plus population. Her public health nursing background includes time spent serving as a licensed school nurse on the Leech Lake Indian Reservation and in North Minneapolis. Dr. Brown brings her research and practice expertise to the MIST team at the School of Nursing, a collaborative of researchers focused on addressing the needs of youth who trade sex in Minnesota. She has been an active member on MIST team projects since 2020. Dr. Camille Brown.
Hi there, and thank you so much for that introduction. I'm going to go ahead and share my screen. I've got just a couple of slides. I only have 5 minutes scheduled to talk, so I'm going to be talking fairly quickly. So the first thing I want to acknowledge is that the words that Jarrett was sharing coming from this provider, service provider study absolutely reflect in the numbers that I'm going to be talking about today. So let's see, there we go. This is our team at the University of Minnesota, the MIST team. We primarily work on large data and other projects that help support youth who trade sex in Minnesota. So one of our tools that we use quite frequently at the MIST project is the Minnesota Student Survey, which is this triennial survey that goes out to all public schools in Minnesota in 2019, which we're talking about, 81% of public school districts did participate across Minnesota. So we get this really big sample size, this really big population level survey information. As you can see, this is data that's collected by the state of Minnesota. So we don't collect this data, but we get to look at this data and see kind of on this high population level what our youth are up to. So it's important to know that on the Minnesota Student Survey, the terminology that we use when we're talking about Minnesota Student Survey data is trading sex. And that's because the wording of the question on the survey that we use to analyze this data does use the term trading sex. So while this definitely includes youth who are sexually exploited, and it would include youth who are trafficked and things along those lines, it may also include youth who are trading sex to peers who are also youth and things like that, where for some that might be sexual exploitation, and other people might consider that as trading sex, but not necessarily exploitation. But all of these young people are in 9th and 11th grade that we look at. So they are young people generally under the age of 18. So it's in the 2019 survey, we found that 1.4% of all 9th and 11th grade students who responded said that they had traded sex. And we're going to talk in terms of cisgender boys for this part of this presentation. And among cisgender boys, 1.2% self-reported that they traded sex. So we know that this is happening. And keeping in mind that this is a sample of 81,000 or so, that is a lot of people. 1% still represents, 1.2% still represents quite a big number of folks who are trading sex, cisgender boys here. We see that when we look at prevalence by race and ethnicity, just like Jared was talking about, Black, African, African-American youth, Native Plus youth, and Hispanic, Latinx youth, along with youth who have multiple races, do have higher percentages of trading sex. So it's confirming what Jarrett was just talking about, that those are the youth who are most often seen seeking services, and those are the youth who are telling us on this survey that they're trading sex at higher rates. Just a note that Native Plus, for this survey, we use a term Native Plus, which includes all students who identify not only as American Indian or Alaskan Native, but they might also identify as Native Hawaiian or other Pacific Islander, or any combination of American Indian, Alaskan Native, Native Hawaiian, or Pacific Islander, and another ethnic or racial identity. And we do this because we talk to partners in Indigenous communities, and they want to include all of those folks in the sample. And it's important to make sure that we're following data sovereignty and using data in the way that Indigenous populations and Indigenous nations want us to use that data. So just want to point that out real quick. Additionally, Jared mentioned that sexual orientation is something that has disproportional impacts, and we absolutely see that in this survey as well. As you can see, 7% of cisgender boys who identified as gay are trading sex, said that they are trading sex. So that's a much higher percentage than that, than their heterosexual counterpoints who are trading sex at 1% or so. You'll note that pansexual, bisexual, and questioning youth are also trading at higher rates compared to heterosexual youth. But it is also really important, and I'm really glad that Jarrett highlighted this, that heterosexual cis boys are also trading sex. So cisgender heterosexual boys are trading sex at 1%. And that's still going to be quite a big number when you look across the entire state. So it's important to make sure that while services are inclusive of LGBT or LGBTQ youth, when you're talking about cisgender boys, it's important to also recognize that they need to be accessible to heterosexual boys as well. One of the things that we really highlight with the MISS team is that youth who trade sex are just like all other youth, and they have hopes and dreams, and they have a lot of resilience. And so one of the things we like to highlight is that we know that cisgender youth have plans for after high school. So all of these students are in public high schools across the state of Minnesota who answered these questions. And they said that after high school, all of the cisgender boys who trade sex who answered this question, about 2/3 said that they want to go into higher education once they graduate from high school. About 15% had plans about work and career training. About 6% are planning to join the military after they leave high school. And 11% had other plans. So it's important to recognize that while these youth are vulnerable and are having experiences that may be traumatic or cause some poorer outcomes, put them at risk for higher poorer outcomes, that they also have hopes and dreams. And so we always like to highlight that at the MISS team. Like I said, I only had about 5 minutes to talk today. So if you'd like to learn more, we did recently publish a paper in pediatrics. We'd like to thank the Carlson Foundation, of course, for funding our team. And we should soon have a infographic coming out on cis boys. We're in the 3rd round of edits on it, so that should be coming out fairly soon. But please feel free to check out our article if you have time. And that's what I've got.
Thank you so much, Dr. Brown, for all your work in this particular field. We're very grateful, and as sure as the youth are also grateful. Next up, we have Ms. Beth Holder. Ms. Holder is the CEO for The Link, a youth and adult-led nonprofit in North Minneapolis, Minnesota, that provides frontline crisis intervention, supportive services, street outreach, emergency shelter, and housing to youth and young families experiencing homelessness, sex trafficking, or who are involved in the juvenile justice, non-justice, and foster care systems. Prior to this position, she was the Homeless Youth Services Coordinator for the Minnesota Department of Human Services, directing the state's work in the areas of runaway, homeless, and sex-trafficked youth. Ms. Holger also worked for Avenues and The Bridge, both in Minneapolis, with street outreach, emergency shelter, and housing programs for youth experiencing homelessness, and worked for Kennedy High School, coaching girls cross country and track and field for 14 years. Holger, I am grateful and honored to have you here today. Thank you.
Thank you so much. I first want to truly thank the Carlson Foundation. They have not only been a funder of all of this work, but have really, really worked hard to raise the awareness about the issue. And I'm so thankful that they're raising the very much needed awareness about the issues of boys and young men being sexually exploited and trafficked. I also want to thank the University of Minnesota and Jarrett Davis for your great research. Really appreciate it, and I'm honored to be on the panel. So I was asked to speak from someone from a perspective of the front lines of working in this field, and I'm happy to do that. As Jarrett mentioned earlier, unfortunately, the Link is one of the very few providers of services for sexually exploited youth and young people that is inclusive of boys and all gender identities. And the reason I say that's unfortunate is just because we do see across the board unfortunately, the reality is that boys and girls, all gender identities, there is a demand for them within sexual exploitation and trafficking. So we absolutely do see boys, cisgender boys and young men being sexually exploited and trafficked. And we also see transgender and gender nonconforming youth also being trafficked, as well as, of course, girls. What we are continuing to see when we passed the Safe Harbor Law in 2011. And I want to really also give a shout out and credit to the attendees on this webinar, because so many of you work on the front lines, with us, with me at the link, and you do incredible work and have been a huge part of the anti-trafficking movement. So thank you for everything you're doing. And because of that, we, as well as the Carlson Nelson family, we were able to pass the Safe Harbor Law. And we wrote the law specifically to be very inclusive of all gender identities. So that was very purposeful and intentional. However, across the country and in Minnesota, there still are a lot of trends, some within law enforcement, where a lot of the stings and operations are typically focused on female victims. That's true. Still, a lot of the prevention materials and marketing materials are aimed depicting female victims. And we also see the majority, not all, but the majority of the services, shelter and housing within Minnesota and across the link being, or I'm sorry, oh my gosh, across the state being geared towards female identified victims. So all of that makes it really harder for boys and young men to come forward. What I'm really thankful about is to the amazing team that I have at the link. We have targeted street outreach, emergency shelter, housing, and supportive services, and mobile case management, aftercare, you name it, that is very inclusive of boys. So what we saw in 2023, for example, was up to between 7 and 17% of our safe harbor or our programs for trafficked youth identified as male. So our passageways housing program was the highest, with 17% of the young people served during 2023 identified as male. Our shelter was 7%, and supportive services was 10%. And so we want to keep increasing that, of course. But what I'm really thankful to say is that that is happening. And one of the things that one of the biggest things we've seen among boys and male victims that they say that they need is they do want some of the same things that our girls or female identified victims say they need. They want things such as a safe, trusted adult that is not going to judge them and come for, work with them in a harm reduction trauma approached model and be there for them during non-traditional hours and things of that nature. So we definitely see that. We also see boys and young males, like the research was demonstrated, there are definitely LGBTQ males that are overrepresented. And I just want to say a little side note about that. What I will say very strongly is that I believe that the reason why we see LGBTQ males or young people overrepresented is due to the fact that we see LGBTQ young people overrepresented in our runaway and homeless youth population. And those are the most targeted to be recruited into trafficking. So that could be because of being disowned, kicked out of their family, etc. It's definitely not because of any other reason, other than that, I don't think. And so, but we also still see cisgender, straight, heterosexual males doing what they call gay or, pay for being gay. Most of the buyers we're seeing are still men, not always, but majority of buyers of boys or female victims are men. And then they're typically much older. And then we're also seeing the need for, from the young people, they want some male identifying staff. So we've really worked hard at the link to recruit some amazing male staff members. Some are who are attending this webinar. Thank you. And then they also want safe, inclusive emergency shelter and housing. And they want really just adults that are going to believe in them and support them. The other thing that's worked really well for us at the link, I will say, with males is we have a youth and adult leadership model. So we have a survivor advisory committee that's made up of youth with lived experience of sexual exploitation and trafficking. And I want to say we have the highest number of males on that committee. And to see their leadership grow within the anti-trafficking movement, what I feel like it just recruits, that's why we're seeing the numbers of boys increase that we serve at the link, is because of these amazing and very brave boys and young men coming forward. And I know that my time is coming to a close, but I just want to make sure that we really work hard to be inclusive of boys and young men in not only the research but in our day-to-day practices, right? And also just wanted to give a special shout out to our transgender young people who are being trafficked at much disproportionate rates as well. We have worked with transgender young people at the link who have said that there is a small niche or demand for young people that identify as transgender but haven't had gender reassignment surgery yet. So we are working really hard to support, like I said, all gender identities at the link, but just to let you know that this is a reality of what's really happening across the board. So I'm happy to turn it over now to the next segment. Thank you.
Thank you so much, Ms. Hoger, for all the work you do and your kind words. We're also very, very thankful of your work. Next up, we have Cristian Eduardo. Cristian is an advocate, speaker, and educator for anti-trafficking initiatives, including the Equality Model, and an advocate for immigrant and LGBTQ+ rights. He is a survivor of international and domestic human trafficking, a queer Mexican immigrant, a person living with HIV, and someone who speaks openly about the mental health challenges he has faced the frequently result for trauma. Cristian Eduardo is a survivor leader at New Yorkers for the Equality Model, Sanctuary for Families, New Jersey Coalition Against Human Trafficking, Alliance to End Human Trafficking, United States Committee for Refugee and Immigrants, and a member of PACT Survivors Council. He is a co-chair of the New York State Anti-Trafficking Coalition and the co-founder of United Immigrants of New York and Mujeres en Resistencia, coalition of advocates focused on creating awareness and educating about gender-based violence, including femicide, and connecting the Spanish-speaking community with accessible resources. Cristian Eduardo's inspiration for his social justice work is to give insight that victims always remain human beings. It is with great honor that I have the pleasure of introducing Cristian Eduardo.
Thank you. Thank you so much. Really, this conversation, taking back, I was trafficked less than 10 years ago, and everything that has been said truly resonate with me because after my trafficking experience, I experienced all that Jared was saying. The lack of services, the lack of trauma-informed approaches, all this normalization of exploitation, this re-traumatization, not believing on male victims, not listening to male victims, because I was just male presenting. There were no services for me. And sadly, I have, in all these 10 years, like, I haven't really seen changes. And I'm very grateful that there's now research, because through storytelling, I'm now doing a lot of training and technical assistance to the United States and in a couple of different countries. And Jared was really at the end was naming this, that there's this trending, that this is, even if this is happening on this state, the reality is that this trending also it's resonating in a lot of states. Every single time that I'm training about the male victimization, that I'm sharing my story as a male survivor of human trafficking, other males disclose, other males start sharing their stories. And it is sad because that really highlights how there are no safe spaces for males to disclose, how there are a lack of services, how still as a society, we have not created these services for us males, and not only kids, for also adults, where we can receive the support so we can really heal from the exploitation that we have received. And it's very interesting because I was trafficked when I was 24. So the research truly resonate with me. One thing that I really want to highlight is that it's very, very important that we continue funding research. Storytelling is a big part, but one big thing that I have seen is that even if I do storytelling, even if I tell my story, it resonates with people, but a lot of times people still don't believe. People say like, is it really happening to males? Is it really happening at this level? Do we really want to invest in services for males? And one is, once it's back up with research, storytelling and research, people, service providers really want to start investing on services, and really society start wanted like to face reality. And it is hard like to face reality, because even if we have numbers now, I really think that there are more victims of more male victims of human trafficking. And I think that we really need to understand that a lot of times it takes not days, not months, but truly years to really disclose, to be comfortable, to find the right person, the right services, or just another human being to make you feel safe, to be able to say, I think that I was trafficked, or just sharing your story, and someone who has been to trainings and has this trauma-informed approach, and they are able to understand you, to hear you, to make you feel human again, and be like, okay, I'm here to support you. I'm here not to blame you, but see you as a human being, and not to put shame on you. So it's very important to continue funding all these things. Male victimization is not new. It's coming out of the darkness because of research, because of storytelling, but we need to continue doing more of this. We need to continue having this conversation. One of the big things that I'm seeing is that a lot of organizations that are working in the anti-trafficking sector, a lot of organizations that are working with kids, dealing with homelessness, with foster care. On my trainings, one of the big things that I do is asking them who has received training in trauma-informed care, and just maybe 1-2 people raise their hand, and that's very concerning for me, because a couple of people before were saying this. Is not the societal norms, but also it's very important to understand trauma responses. I think that a lot of times people don't realize that aggression is a trauma response, and it's not a natural trait of males. So if we don't understand trauma, if we don't understand how trauma has an impact in the body, we cannot really serve male victims. So I'm very grateful that we're having this conversation. I can talk for hours about this, but males, we deserve better. Males can be victims too. Males are being victims right now, and we need to really invest in services. We really need to invest in trauma-informed services, housing, mental health, economic empowerment programs. And one of the big things that I really want to highlight, community building. We need healthy community building programs for males, because we just look at males when males become perpetrators, and we need to stop that. Males are victims too, and we need to support them. So thank you so much, and I think that we are now moving to Q&A.
Thank you so much, Cristian Eduardo. Really appreciate your words, and thank you for sharing your story and communicating those words to us. Right. We will now move to the question and answers portion of the show, and I do thank the panelists who have already been answering some of the questions that we have been getting on the chat. I'll begin with the first question. It comes from an anonymous attendee. Says, from your expertise, would you say that Minnesota youth serving individuals are aware of human trafficking, or is that something that is needed? Would anyone like to take that question?
Do you mind repeating the question again? Sorry.
Sure, not a problem. It says, from your expertise, would you say that Minnesota youth serving individuals are aware of human trafficking, or is that something that is needed? I'm guessing to raise awareness within Minnesota youth serving organizations or individuals.
I think it depends on the area. I think that, you know, many of the homeless youth service providers, for example, have had extensive training. Our street outreach collaborative called Streetworks and street outreach workers have had extensive training. I do feel like there's fields of youth services though that have not. You know, our teachers, our social workers within schools, some of our juvenile probation officers. So I just, you know, kind of depends. That's a huge question and a really good one, but it just kind of depends on the field. We've done some amazing training and awareness building within some sectors of youth services, but not in others. And then we have to keep it up, right? Because then there's turnover. As soon as you get people trained in and you get good partners in one system or one provider, then the what we find is the staff turnover. So I think it's also something we have to continue to do.
If I can add one big thing that I see is that a lot of time on boys there's more focus on labor trafficking than sex trafficking. So that's one big trending that I see in all over the United States. And a lot of times, even when organizations have work with girls and women on sex trafficking, they are afraid to assess or interview boys on sex trafficking, and I don't really understand why. I think that is the socialization, the cultural norms that we have. They have all the skills, they have been trained, but it's just that they feel and they are afraid to transfer this skill and start working now with male.
I really want to echo that as well. We as part of the Miss team, we actually did some interviews with school nurses a number of years ago now, 2020. And what the school nurses talked about is they definitely talked about working with youth who were sexually exploited. And we had various levels of experience with those youth. Particularly among school nurses who worked at alternative learning centers and things along those lines. And they spoke almost exclusively about girls or trans youth, and didn't talk about boys at all. So I think that there, like Beth was saying, in schools, I think there is some awareness, but that it is very focused on girls and to some extent trans youth as well. And we know that those are disproportionate rates and there's higher percentages and things like that, but then there's almost no acknowledgement of the boys who are involved in this.
Yeah.
Particularly cis boys.
Yeah. I've really noticed in a lot of my recent work, especially, that the binary really tends to trip us up, because we have kind of prepackaged ideas of what we're going to get based on what box we've ticked, right? And that just isn't how human identity works. That's not how vulnerability works. You know, we know this, but it's one of those things where it's just, I think there's a lot of kind of self-analysis and self-challenging that kind of needs to happen, I think, in this process.
Well, thank you very much. And I think that also answers a couple of other questions that were in the chat.
Oh, was it? Okay, cool.
Thank you. The next question comes again from an anonymous attendee. Were members of public safety or the justice system part of the study? If not, why were they not taken into account when there is clearly much work needed?
I would love to have been able to focus on that. It was a kind of limited mapping study. Our purview was really looking at what service providers, people who are directly engaging with these populations, are experiencing. That is definitely needed. And in our conversations, you know, our conversations kind of naturally started to bridge into some of that. And we got into public safety quite a bit, actually. Once we got into learning workshops, and this was discussed in the report, we started to find that a lot of, and we know this from other research as well, but a lot of a lot of the boys coming through the justice system, they are, like we said in the presentation, a lot of those signs and symptoms of trauma. And the complaints that you see about service providers working with boys, they're hyperactive, they move too much, they can't pay attention. If you go through that list of complaints that are really common for boys, and you go through a list of the signs and symptoms of trauma, those lists are very similar. It's quite difficult to actually differentiate the two. And so I think that's something that we need to really take into consideration, especially as we have this school to prison pipeline that often will put particularly certain racial and ethnic or groups of boys in prison, or identify them as a threat before they will the other population. So that's where you start seeing this disproportional risk as these things intersect.
And coming from my experience as a public health nurse who worked with students who had been incarcerated, oftentimes there are incidents of trading sex going on within our jails and within our juvenile justice system.
Yep.
So it's really, really important to recognize how that feeds into the problem as well.
Yeah. I think destigmatizing some of this, just realizing, I think this is where I think your work, Camille, and looking at like trading sex and looking at sexual exploitation, our worlds need to talk more, a lot more. Like the world of like vulnerability, sexual exploitation. We need to be talking with sex workers unions. We need to be talking with.
Yes.
We need to understand more about all of, because it's one world, right? It's one experience. And these nuances are there. And sometimes the best people to actually identify these, vulnerability are people who are trading sex, people who are side by side, rubbing shoulders with those who might not have agency in this, and now obviously, they're under 18 if they're young, that's another thing. But yeah.
And I will say that some of the most vehement opposers to, or people who advocate for youth who are exploited are sex workers, because they are aware of the safety concerns and they are aware of some of the harms that can be done. And, it's something that also really impacts their ability to work and work safely because of some of the things that are going on. So I absolutely agree. Engaging folks who are trading sex, adults who are trading sex, or sex workers, engaging them in this work is important as well.
Yeah, absolutely.
Thank you so much for that wonderful answer. We're running out of time, but we do have time for more questions here. This question comes from Mary Pulido. What can be done to increase shelter beds? Is government funding available? Will they come to the table?
That is a great question. And what I will say is I can speak for Minnesota, that we have a wonderful coalition of youth service organizations called the YSN, or the Youth Services Network. And then we have a policy subcommittee of that group that includes a lot of pretty much youth from the link that have lived experience of homelessness or trafficking. And so we are continuing to advocate for increased resources. We had a bill in this year, we do every year, for increased funding for emergency shelter and housing, because there absolutely is not enough funding. And that is the main driver of why there isn't more, along with, which I can't get into, it's a whole nother presentation, but the way that licensing regulates minor youth shelter also is a huge barrier for people, and the way that emergency shelters are zoned within cities. So those three things are all things that are being worked on and advocated for by community and like community frontline providers and youth with lived experience. And so we're going to keep going. But yes, but it's a huge need. We've made huge progress. Like, I'm old enough to remember the days where we had zero, no shelter beds, no housing units, nothing. And these youth were being arrested. And if they were very rarely found by law enforcement. Okay, let's be real. But if they were, then they were arrested and charged with juvenile prostitution and placed in the JDC. So we've come a long way, but we have a lot more to do, and we are definitely working on it.
Yeah. I also just need to say 100% that also as an outsider coming into Minnesota and getting it is my job to be critical of everything, right? But I was deeply impressed with what is developed there and with the capacity of the people that are doing the work and the commitment and dedication and the understanding of nuance and those gray areas. And yeah, the problems are still there. These are systemic issues, but I was very, very impressed. You know, looking into Christian and I both are in the city of New York, and you know, thinking about us, like I can't say that I know that we're nowhere near as connected and functional as what you find in Minnesota, but it doesn't undercut the fact that this is still a massive issue.
Thank you so much, Ms. Hoger and Garrett, for those fantastic words. Your words give us hope. Absolutely. One special announcement that I would like to make, if anyone out there knows of, or perhaps there is a survivor or the survivors in attendance, please feel free to reach out to us. The administrator, the webinar administrator will put shortly the email where you can contact PACT for needs that perhaps or guidance that you might need, or perhaps you want to collaborate and work with us or be part of the Survivors Council. This is important work, and there's no more powerful voice than yours this particular time. So please, the webinar administrator will put the email shortly on the chat. As we now begin to draw closer to the end of this webinar, I want to remind each of you in attendance that although the webinar is ending, our fight and advocacy to end trafficking and exploitation continues. Human trafficking. Your efforts and collaboration make a difference. I want to thank the panelists, attendees, PACT by ECPAT USA, and a very special thank you to the Carlson Family Foundation. It has been a pleasure and an honor to serve as your moderator today. And I do invite you to check for future webinars to be hosted by ECPAT USA or the Carlson Family Foundation. Thank you very much and have a great day.